Hi, my name is Leslie Cochran. Thank you for allowing me the opportunity to speak to you today regarding a request for proposal for health promotion in Bell County with minorities at risk. Population health is defined as a framework for defining why some populations are healthier than others. It includes the policy development, research, and allocation of resources. Despite great progress in public health initiatives from the years of 1900 to 2010, population health remains a challenge for today's healthcare providers. A group of people who are more likely to experience poor health status and access to care are known as vulnerable populations or populations at risk. They're multifactorial in nature, ranging from environmental exposures to poor diet and exercise, social hazards, smoking, or racial stigmas. They work together to create a potentiated effect that leads to poor health status or illness in these subgroups of the population. According to Bell County demographic information, there are two significant minority groups that comprise a total of 46.3% of the population. The first being African Americans, making up 22.4% of Bell County. As you may know, the African American population is an increased risk compared to the Caucasian race of the following disease processes: hypertension, stroke, obesity, and diabetes, leading to an overall increased risk of cardiovascular disease. The Hispanic population comprises 23.9% of the Bell County population. They also suffer an increased risk of hypertension, diabetes, obesity, and stroke. These comorbidities not only result in increased mortality, but a decreased quality of life for both populations. Before looking at the specific statistics and information regarding Bell County, let's take a look at this population health framework by Kindig, Asada, and Boss, so that we have a better understanding of assessing the health framework of a population. Kindig, Asada, and Boss discuss the determinants of health and the population outcomes, how they affect each other. As you can see, the right side of this slide represents increasing the broad health outcomes of the mean population, which is reducing premature deaths, and increasing the mean population health, which means quality of life. Policies and education should focus on noted disparities in relation to race, ethnicity, socioeconomic status, geographic location, and sex. The term health disparity is meant to point a specific difference between groups, demonstrating a worsening health status of socially disadvantaged people. This is particularly true for the disadvantaged racial ethnic groups. The left side of the slide discusses determinants of health. Determinants of health include a range of personal, social, economic, and environmental factors that influence health status. Determinants of health are factors that create vulnerable populations. The determinants may work alone or in combination to affect the healthcare status of the communities. The determinants are divided into 5 parts. Medical care, which includes prevention, treatment, and management of disease. Individual behaviors, which examples are smoking, exercise, and eating habits. Social environment would include income, educational level, occupation. Physical environment, the air and water quality, building structures, roads, and parks. And genetics, of course, are the inherited characteristics that affect health outcomes and often cannot be changed. In reviewing the countyhealthrankings.org, Bell County rankings overall health outcomes and factors are significantly lower than other surrounding counties. I know that this is a lot of information for you to review, but I believe it's important to note the significant disparities in rankings between Bell County and the neighboring counties of Williamson, Travis, and Hays. There are 237 counties in Texas. Bell County is the first column, followed by Williamson, Hays, and Travis counties, respectively. As you can see, Bell County ranks significantly lower in most areas, with health outcomes ranking of 107, health factors 51, health behaviors of 170, socioeconomic factors of 109, demonstrating the highest documented rates of smoking and obesity, the lowest food environment index of 5.4. Even though Bell County did not hold the lowest high school graduation rate with 88%, they did demonstrate the lowest college attendance rate, also the lowest median household income of $50,223. Some areas not listed that were similar or improved in Bell County were a 5th place rating of 237 in the area of clinical care. This is presumably due to the multiple healthcare systems that the county population has access to. Williamson was 4th, Hays 29th, and Travis 9th. 19% of Bell County is uninsured, while the other 3 counties demonstrated 17, 22, and 22 respectively. Environmental issues were significantly better than Travis and Hays counties and similar to Williamson County. So the two most impactful health determinants in Bell County compared to neighboring counties and the state of Texas are health behaviors and socioeconomic factors. Genetic factors play a significant role with a total of 46.3 minorities of African American Hispanics. And we've already discussed the increased risk that they experience. Now that we've discussed county rankings of health outcomes and factors, let's look at the Bell County resources. Bell County has 2 major railroads, 3 large healthcare systems, multiple colleges, Fort Hood military base with a capacity of 50,000 soldiers. It's the 16th largest Texas county at 326,843 people. It has the Bell County Public Health District and Texas A&M's AgriLife, also an extensive emergency response system. Bell County Public Health District provides basic public health services through the following programs: WIC, immunizations, disease surveillance, disaster preparedness, environmental health and food, and Ebola preparedness. No additional education programs have been found that are sponsored or funded by the Public Health District. Given this information, we are excited to partner with the Bell County Public Health District to develop 3 community nursing diagnoses based on the county rankings findings. Our first nursing diagnosis is that Bell County residents have the potential to demonstrate improved health behaviors related to an expressed desire for knowledge of healthy behaviors and activities. This will be achieved by the development of culturally relevant community health education with a focus on healthy behaviors and the establishment of trust by utilizing healthcare providers of same ethnicity. With a health ranking of 170 out of 237 for health behaviors, this will be our first diagnosis and primary prevention intervention. Healthy behaviors that will be addressed are improved nutrition, increasing activity, and smoking cessation. With national goals for Healthy People 2020, focusing on these healthy activities, improved nutrition, and smoking cessation, we will align with these goals to improve overall health by prevention. We will utilize recommendations from What Works for Health by building community gardens for increased physical activity and improved food sources when the produce is ready to harvest. We will also implement the Proactive Tobacco Quit line to assist smoking cessation that has shown significant success nationally. Bell County also has the Bell County Family and Consumer Services. It offers a full nutrition and wellness program made specifically for the Bell County demographic, providing extensive health promotion teaching information online and classroom classes. We will partner with them to promote another option for our minority population. Nursing can support efforts towards healthcare equity with innovative ideas that include diversity in the workforce to meet the needs of minorities. Both issues of language barriers and trust can be overcome by utilizing this method. We will aggressively recruit African American Hispanic minorities as community health professionals. In regards to marketing communication, there is some research that shows electronic online methods of education are not effective with the lower income population and actually create more disparities. Therefore, online and printed materials will be available in both English and Spanish in order to decrease the risk of disparity. There are several forms of recommended evaluation of the dietary quality. The most easily completed is the self-reporting survey. Data collection at the time of consumption, obtained by the interviewer. The method, which is a 24-hour recalls or food frequency questionnaire. There are not any foolproof methods of food consumptions or documentation, but the method 24-hour recall is the one that is most highly recommended. Our second nursing diagnosis is minority populations in Bell County have the potential for achieving improved health literacy as related to lack of understanding of health risks related to ethnicity. This will be achieved by developing culturally relevant, simple health risk educational materials and reinforcement of coordinated school health program. Cohenall noted that in the Department of Education's National Assessment of Adult Literacy was able to identify only 12% of U.S. adults capable of understanding health information with enough clarity for practical application. Health literacy has become a focus of high priority in healthcare initiatives of the 21st century. The purpose of these initiatives is to provide healthcare education and communications to the public that is clear, simple, and easily read. We will use simple teaching tools from the CDC's program, the State of Heart Disease and Stroke Prevention Program, with the intention of early screening and diagnosis of disease. We will also reinforce the existing coordinated school health program by working with teachers and administrators. This will strengthen prevention through the increased awareness and education of entire families at the risk factors and lifestyle changes that affect cardiovascular disease. Resources that we will utilize in the community are American Heart Association affiliates, industry, PTA, unions, Department of Education, school health, fire departments, faith organizations, local health departments, and local nursing association. In regards to evaluation, we'll use the data is needed to determine your health community's literacy level. So it's imperative to be effective that we collect data before and after the intervention. The CAPS item set for addressing health literacy is a CDC recommended tool, and we have chosen it to evaluate our program. Our third diagnosis is that Bell County has the potential for achieving an increased academic achievement related to the percentage of college attendees, which is 63.8%. Neighboring Williamson County is 74.4%, with a national average of 71%. Achieved by implementation of programs to recruit and train minorities, students for health careers, and promotion of available college funding for minorities. Right now, 25% of the U.S. population are minorities in our country, but only 10% of healthcare professionals are minorities. To improve community healthiness, we will utilize recommendation of what works for health by recruiting and training minority students for health careers. This will be supported by the local government and the public health district. Multiple programs exist to recruit and minorities to healthcare, with many of them beginning in grade school through high school graduation. Some of these same programs offer college funding. Our third and final nursing diagnosis is an upstream intervention. Upstream factors are housing, neighborhood conditions, school, work conditions, and socioeconomic status that have a direct effect on the quality of living, which in turn improves overall health. Williams, Costa, Odunlami, and Mohammed suggest this idea as an additional solution to focusing on improved access, insurance coverage, and quality and intensity of health care to eliminate disparities. He contends that healthiness is related to direct living and working conditions. Other community resources that we will use will be the public school system, the PTA organization, higher learning institution, and healthcare systems. This intervention will give back to the community with additional anticipated outcomes of increased high school graduation, college enrollment, diversity of healthcare workforce, and increased income, which in turn will improve overall socioeconomic status. Evaluation will be a long-standing goal, with improvements noted as an increase in minority health professions. Community readiness. Community health needs assessment was completed in Bell County in June of 2013. As a result of that assessment, request from the participants for education regarding healthy nutrition and improved access to better foods. Also, a request for recreation facilities that were closer to home and didn't require so much travel. Health literacy, we'll evaluate our readiness with our survey that we already discussed about. And then our third diagnosis of education is demonstrated by the county ranking for the college attendance. Cost benefit of these interventions. Cardiovascular disease is a leading cause of deaths, with 610,000 per year. The total estimated related cost in 2010 were $444 billion. Accounts for $1 of every 6 spent in healthcare, and the only real method to decrease costs is through health prevention. This is my logic model for our processes for our community health minority populations, with our 46.3% of minorities in Bell County. In summary, our interventions will be that we'll implement teaching to promote healthy behaviors, implement teaching to address health literacy, support higher education with recruitment of minorities to healthcare profession, expected outcomes, improvement health behaviors, improved health literacy, increased number of healthcare minorities, and in the end, will improve the quality of life for the residents of Bell County.